Hi everyone, this is Mansoor Mirza. I'm clinical oncologist from Copenhagen University Hospital in Denmark, and it's my pleasure to discuss with you what new is happening in endometrial cancer and what has been changed in the past couple of years. There has been dramatic improvement in the outcome of our patients, and the treatment has become better. Um, so the whole thing started 10 years ago when we looked at tumors, at their genomic profiling, and we found out that this is not just endometrial cancer, which usually histologically we called it two types of tumor, type 1 and type 2, and we're trying to treat like that. It seems like that there are multiple um, subgroups of molecular subtypes within the endometrial cancer. Here you can see down under the poly is a very small number. It's about 3 to 1, actually 1 to 7%. If it is early stage, it may be all up to 7%, but in advanced stage, only 1%. These tumors are very highly mutated. They are so mutated, their chromosomes are so mutated that they cannot divide themselves. So here we are trying to de-escalate the treatment of our patients, probably in the stage 1 and stage 2. If one see a polymutated tumor, we do not need to give any further treatment than surgery. And we are still discussing also in the stage 3, where there is no residual disease, if we could do the same. So this is a really good prognosis patients, because these tumors sort of kill themselves and do not divide. Um, the second one, the green one, is MMR deficient. So these are the ones which are extremely susceptible to immune checkpoint inhibitors. So I'll show you how we have completely exploded the trials of immune checkpoint inhibitors and added immune therapy to the treatment of our patients from the very beginning. And the other two, the yellow one and the red ones, are still amenable to immune therapy but lesser extent. Especially NSMP is a type of tumor which may be a little bit slow growing, and it may be helpful to treat them with endocrine therapy, hormonal therapy. There are also new drugs coming in like selinexor, which will be very promising in this population. And then comes the red ones, the P53 abnormal. Until we had all these new drugs available, this was the worst disease. They do not respond that much to chemotherapy. The prognosis was poor, but it seems like that we are improving that also dramatically with the new available drugs which are coming in. On the right side, you can see when this analysis was performed, how these different type of tumors are performing. The light blue, which is poly, they do not have any progression, while the red ones are really bad. And we have tried to work on that and changed by the new treatments available and how we are doing. So if we go back to where we were earlier, um, this is where we were. We had a classification how to treat the tumors, but we already in 2021 decided to introduce molecular classification and guiding our doctors, our colleagues, to treat the patients according to molecular classification, because then you are not under treating or over treating the patients. It's more harmonized, and according to their molecular mutations, you treat the way. This is now being changed because we have now also new FIGO classification, and we have more knowledge how to treat these patients. So you will soon see next edition of guidelines coming in, which are much more molecular guided which is the future for our treatment paradigm.